At 68 years old, my blood pressure hit 158/94. My doctor looked at my chart, looked at me, and said the words I'd been dreading for years. I think it's time we add another medication. I went home that night and I didn't sleep. Not because I was scared of the pill, but because something didn't sit right with me. I'd already made changes. I was eating better, I was walking every day, I was doing everything I was supposed to do. So why was the number still climbing? What I discovered over the next several weeks changed everything. And what my blood pressure did in response, naturally, without a new medication, is the reason I'm making this video today. Because what's driving high blood pressure after 60 is almost never what your doctor is talking to you about in that 15-minute appointment. Stay with me. What you're about to learn in the next few minutes is rarely explained to seniors. And it should be. After 60, high blood pressure becomes the single biggest threat to your independence, not just your heart. We're talking about stroke, kidney damage, vision loss, the slow erosion of your ability to do the things you love, travel, garden, play with grandchildren, drive yourself where you need to go. And here is the part that frustrates me most about how this condition gets managed. Most doctors treat the number. They look at the reading on the cuff, they write a prescription, and they move on. Very few stop to ask the question that actually matters. What is causing that number to be high in the first place? Because if you don't address the cause, if you only manage the symptom, you will be chasing that number with higher and higher doses for the rest of your life. And the research is very clear on what that leads to. What if the real problem isn't salt? It's not stress, and it is absolutely not just an inevitable consequence of getting older. What if there is a specific, identifiable, and correctable root cause, and almost nobody is telling you what it is? That's exactly what we're going to talk about today. My name is Dr. Isa, and this channel is dedicated to one thing: helping adults over 60 understand what the research actually says about their health in plain language, without the jargon, without the condescension. And what I'm about to share with you isn't a theory. It is backed by a growing body of research that cardiologists and longevity researchers have been paying very close attention to. Here is the real root cause that most doctors miss after 60. Chronic low-grade inflammation, combined with progressively stiffening arteries triggered by hidden daily habits that almost every senior unknowingly has. Let me break that down, because each of those three pieces matters. First, arterial stiffening. As we age, the walls of our arteries naturally lose some of their elasticity. Think of a garden hose that's been left in the sun for years. It gets stiffer, less able to expand and contract with each heartbeat. When that happens, your heart has to work harder to push blood through, and that resistance shows up as a higher number on the blood pressure cuff. This is not inevitable. The rate at which your arteries stiffen is deeply influenced by your daily habits, and that is excellent news. Second, chronic low-grade inflammation. This is the part almost nobody talks about in a 15-minute doctor's appointment. Inflammation is your body's natural defense system. Short term, it's healthy. Your body gets injured, inflammation arrives, healing happens, inflammation leaves. But after 60, something shifts. For many people, inflammation stops being a visitor and becomes a permanent resident. It sits in the walls of your blood vessels, quietly damaging the lining, making them stiffer, making them narrower, making your heart work harder all around the clock. And here is the critical part. This kind of inflammation has no obvious symptoms. No pain, no fever, nothing that would make you pick up the phone and call your doctor. It just quietly drives that number up. Now, the reason this matters so much is that inflammation at this level is almost always being triggered by specific identifiable habits. Habits that most seniors have without realizing it. I'm going to walk you through the 4 biggest ones today. And I'll tell you right now, the third one is the one that stops most people in their tracks, because it's something you do every single night, something that feels completely harmless. But first, you need to understand exactly how these triggers are working against your body on a daily basis. Because once you see the mechanism, the solution becomes obvious. Let me introduce you to Margaret. Margaret was 71, a retired school teacher from Ohio. Active, sharp, she cooked most of her own meals, she walked her dog every morning, she took her blood pressure medication faithfully. And yet, her readings never came down below 145. When we looked carefully at what was actually going on inside her body, the picture became very clear, very quickly. Margaret's diet was full of what I call invisible inflammation triggers. Not obvious junk food. We're talking about vegetable oils, refined grains, and ultra-processed foods disguised as healthy choices. The kind with labels that say whole grain or low sodium, but that are loaded with compounds that keep the inflammatory response permanently switched on. Here is what the research shows. Adults over 60 who carry elevated markers of systemic inflammation, specifically a protein called C-reactive protein, have blood pressure readings that run, on average, 18 to 22 points higher than those with low inflammation levels. 18 to 22 points. That is the difference between a reading your doctor is comfortable with and one that has him reaching for his prescription pad. And the most powerful way to address that inflammation is not a medication. It is identifying and removing the daily triggers that are feeding it. I'll come back to exactly how to do that. But first, trigger number 2. And this one will surprise you. I want you to notice something right now as you're watching this. Where are you breathing from? Most people, if they pay attention, will notice they are breathing from their chest. Short, shallow breaths, maybe 15 to 18 cycles per minute. Now, here is why that matters enormously for your blood pressure. When you breathe shallowly from your chest, your body interprets that as a low-level stress signal. It activates a system called the sympathetic nervous system, your body's fight-or-flight response. And one of the first things that system does is constrict your blood vessels and raise your heart rate. This is not a theory. This is basic cardiovascular physiology. The problem is that after 60, many people fall into a chronic pattern of shallow chest breathing, especially those who spend a lot of time seated, who have any degree of anxiety, or who have simply never been taught anything different. And they are walking around with their sympathetic nervous system dialed up all day long, which keeps their blood pressure elevated around the clock. The research on slow diaphragmatic breathing, and the beautiful thing is, this costs nothing. It requires no equipment. You can start tonight. I'll give you the exact protocol at the end of this video. But hold on, because trigger number 3 is the one I mentioned earlier, the one that happens while you're asleep. And most people have no idea it's happening. Before we get to the sleep trigger, I want to address the food conversation, because I guarantee you have been told the wrong thing. You have been told to reduce sodium, maybe avoid red meat, watch your saturated fat. And while those things are not irrelevant, they are not the biggest dietary driver of high blood pressure after 60. Not even close. The research is increasingly pointing to something different. A chronic deficiency in potassium, magnesium, and omega-3 fatty acids, combined with an excess of a specific type of carbohydrate as a far more powerful driver of elevated readings in older adults. Here is the mechanism in plain language. Potassium and sodium work together to regulate the tension in your blood vessel walls. Most Americans consume roughly a 1-to-5 ratio of potassium to sodium. The ratio your cardiovascular system was designed to thrive on is closer to 4-to-1, the other direction. That imbalance, not sodium alone, is what drives vascular resistance up. Magnesium is equally critical. It is the natural calcium channel blocker your body produces on its own. When you are deficient, and studies suggest the majority of adults over 60 are, your blood vessels lose their ability to relax properly between heartbeats, and they stay contracted, which means they stay resistant, which means your pressure stays high. The solution here is not a complicated diet overhaul. It is a strategic addition of specific foods, and in some cases targeted supplementation, that restores the mineral balance your cardiovascular system depends on. I'll outline exactly what that looks like in the action plan at the end. But now, trigger number 4, the one I've been building toward, the one that is silently spiking your blood pressure while you sleep. Let me tell you about Robert. Robert was 74, a retired engineer from North Carolina. He was disciplined about his health. He exercised, he watched what he ate. He took his medication every morning without fail. But his doctor couldn't understand why his morning blood pressure readings were consistently the worst of the day, often hitting 155 or higher, even after a full night of sleep. The answer, when it finally came, wasn't complicated, but it had been completely overlooked. Robert had mild, undiagnosed sleep-disordered breathing. Not severe sleep apnea. Nothing dramatic enough to make him gasp or wake up choking. Just a subtle pattern of shallow, disrupted breathing during the night that was triggering repeated microarousals. Brief moments where his nervous system kicked into high alert, released stress hormones, and drove his blood pressure up for seconds at a time. Dozens of times per night. Every night. For years. Here is what the research tells us. Adults with even mild sleep-disordered breathing have significantly elevated nighttime blood pressure. And critically, they show what researchers call non-dipping. Under normie circumstances, blood pressure naturally drops 10 to 20% during sleep. That nighttime dip is protective. It gives your cardiovascular system a true period of rest. When that dip disappears, when your pressure stays elevated all night, the cumulative damage to your arteries, your kidneys, and your heart accelerates significantly. And the risk factors for this kind of disrupted sleep are extremely common in adults over 60. Increased airway resistance as tissues age, weight changes, sleeping position, alcohol consumption in the evening, even moderate amounts, which relaxes the muscles of the airway in ways that disrupt breathing cycles. The most telling sign is not snoring. It's waking up after a full night of sleep and feeling like you haven't rested. It's afternoon fatigue that doesn't make sense given how much time you spent in bed. If that resonates with you, and for many people watching this right now, it will. That is the signal worth paying attention to. I'll tell you exactly what to do about it in just a moment. But first, let me show you what happens when you address all 4 of these triggers at once. I want to be honest with you about what is realistic here, because this is not a video promising you miraculous results overnight. That is not who I am, and that is not what the research supports. What the research does support, consistently, across multiple peer-reviewed studies, is this. When adults over 60 systematically address the root causes of vascular inflammation and arterial stiffening, not just manage symptoms, blood pressure responds. Often meaningfully, often faster than people expect. In studies examining combined lifestyle interventions targeting inflammation and autonomic nervous system balance, systolic reductions of 15 to 25 points have been documented in older adults over 4 to 8 weeks without medication changes. I'll be direct. Not everyone will see those numbers. Your results depend on which triggers are most active in your body, how long they've been present, and how consistently you apply the approach. But here is what I can tell you with confidence. If you are doing everything your doctor told you, and your numbers are still not where they should be, it is almost certainly because the root cause has not been addressed. And that is not your fault. It is a gap in how this condition is typically managed after 60. What you're about to get is the framework I use. Simple, practical, grounded in the evidence, and something you can start this week. Here is the 3-step protocol that addresses all 4 triggers and delivers the most meaningful impact in the shortest time. The first thing I want you to change happens before you eat a single bite in the morning, before you take your blood pressure medication, before you have your coffee, before you check your phone. Spend 10 minutes doing slow diaphragmatic breathing. Breathe in slowly for 4 counts, hold gently for 2, exhale slowly for 6. Repeat. This activates your parasympathetic nervous system, the body's natural counterweight to the stress response, and begins to lower vascular resistance before your day has even started. On the dietary side, your morning is also when your potassium and magnesium intake matters most. A breakfast built around leafy greens, avocado, seeds, or a magnesium-rich whole food like pumpkin seeds gives your vascular system the mineral foundation it needs for the day. This is where the food trigger gets corrected, not through deprivation, but through strategic addition. 3 specific additions that the research consistently supports for vascular inflammation reduction in older adults. 1. Omega-3 fatty acids, either through fatty fish 3 times per week or a high-quality fish oil supplement. The mechanism is well established. Omega-3s directly inhibit the pro-inflammatory pathways that damage artery walls. 2. A deliberate reduction in refined and ultra-processed carbohydrates. Not a zero-carbohydrate approach. Simply replacing refined grains and packaged foods with whole food alternatives removes the primary dietary driver of chronic low-grade inflammation. 3. Daily movement, but specifically the right kind. Gentle, consistent activity, a 30-minute walk, swimming, or cycling, has been shown to be significantly more effective at reducing arterial stiffness than the same amount of time spent on higher intensity exercise in adults over 65. Your arteries respond better to steady, sustained movement than to bursts of intensity. This is where you address the sleep trigger, and it is simpler than you might expect. 2 hours before bed, stop alcohol entirely. Even 1 glass of wine in the evening is enough to relax the airway muscles in ways that impair your breathing architecture during sleep. For people with any degree of vascular vulnerability, this is one of the highest leverage changes you can make. Sleeping on your side rather than your back significantly reduces airway resistance and has been shown in clinical studies to improve nighttime blood pressure in people with borderline sleep-disordered breathing. And return to the breathing practice. 5 minutes of slow, deliberate breathing before sleep. This is not a relaxation gimmick. It is a direct intervention on your autonomic nervous system that measurably affects your overnight cardiovascular profile. Many people who apply even 2 of these 3 steps begin to notice a difference in their energy, their sleep quality, and their morning readings within 7 to 14 days. Not because this is magic, but because for the first time, they are addressing the actual cause, not just managing the number on the cuff. Your body wants to regulate itself. It was designed to. Sometimes it just needs you to stop working against it and start giving it what it was built to need. If this gave you a new way of thinking about your blood pressure, please do one thing right now. Comment the word pressure below. I'll send you the free blood pressure tracking guide I put together. It includes a simple daily log, the mineral intake reference, and the breathing protocol written out so you have it in your hands. Save this video so you can come back to it. And if you haven't subscribed yet, I make videos like this every single week. Evidence-based, practical, and built specifically for adults over 60 who are done being managed and ready to understand. And leave me a comment. Tell me, has your doctor ever talked to you about inflammation as a driver of your blood pressure? Or has the conversation always been about medication? I read every single one, and your experience might be exactly what someone else needs to hear before their next appointment. Take care of yourselves. I'll see you in the next one.